So, you ready? Mm-hmm. The elasticon, I usually pre-cut them, and for an adult dog or a bigger dog, I cut 4 pieces for each ear. So I do 2 long, 1 medium, and 1 short per ear, but because she's little, I'm just doing 2 per ear, 2 short, 2 long, and that's the elasticon. I'll meet her now. So I clean her ears with, you still going? Mm-hmm. I clean her ears with alcohol, inside and out, like really get in there, and then this whole part and this part. And then I take some kind of baby powder or medicated powder and just powder the back of her ears a little bit so that when you pull off the tape, it's not so hard on the hair. And also, this little spot in here tends to get like moisture, so I try to get in there good. So we just powder her ears a little bit. You're thinking, I'm gonna do this for 7 months? And then, this is the bonding cement. It's meant for humans, so it's safe for them. The only thing is it kind of smells, so they don't like the smell of it. But you apply this to just the lateral part of the ear where there's no hair. So you just kind of gently paint a little bit up to the tip. Oops. Starting at like the bump right there. And then you do the other side. Let me just turn her. Sometimes it's less.
I'm going to be a pro at this, I guess.
And then you kind of have to let it sit to get tacky for just a minute. Just to let you know, the curve at the tip of her ears is not normal. So, I mean, it's normal for this stage, but it should go straight. So before you do all this, which I already did, when you take the tape off, clean her ears and then massage the edges of her ears, and especially at the tip, and then just stretch her ear up. This doesn't hurt her. You see she's not crying or anything. Just take your hand and massage all of this. I should have showed you this before, but really rub it so that there's you don't feel scar tissue anymore, and do both ears. And then kind of, if it's, you can use a little coconut oil or some Neosporin, but make sure you clean it off before you retape them. Okay. So now we're gonna put the post in. So what you do is it doesn't go in the ear canal. It goes in this little pocket out here. So you put the post in the side pocket, and I just kind of use it like screw it in there. And then, this is important, you pull the ear up as hard, as firmly as you can, and then place the post onto the ear, and you kind of stick it on there. I like to take the hair away so it's not, she's not getting pinched, and you just kind of stick it in there. And it's, as you can see, there's still the ear canal over there, so she's not getting, it's not down her ear. I know. And then you apply the first bottom tape onto the post.
Okay.
Just grab her head and put her over here. Yeah. Gotta be a big girl. Okay. So you apply the tape on the bottom of the post, not on her ear. And it's always gonna go toward the midline. Oops, sorry. So it's gonna go toward the middle of her head. It's okay. Let's go.
This is the worst day of my life.
No. And so the bottom tape you can apply, you pull up as you're pulling it around, and you can apply a little bit of pressure, not much, and then just squeeze the tape on her ear. And that's it. So I always make the post a little longer, and then I just cover the tip of her ear and cut it off. She's like, oh, that doesn't sound so good. And then you take if she had longer ears or she was older, I would take 3 tapes, and I would put the next tape midway and just wrap it around. But because she's little and has, little ears right now, I'm just using 2. So you apply the tape back to the post. This one, anything above the bottom, you don't pull it at all. You just gently place it on and squeeze it down.
How often do you have to change them?
About a week, yeah. So typically, I'm doing only these two because she still has an opening and I want it to breathe. But normally you always tape 2 long pieces at the bottom to give it support.
Okay.
So the next time you do it, she probably won't have any opening. So you can, if she only has, you know, if her ears are still kind of short, you can still do the 2, but then do another piece at the bottom just to provide more support at the base.
Okay.
Okay, so we'll do the other one and you'll be able to see this easier now. So you just kind of stick it in the side pocket, pull up and apply it to the post. And it, right now her ears are gonna look, I'm just gonna steal this tape from you. Her ears are gonna look uneven because one curl is less than the other, but that will all straighten. Apply the tape to the post. You're gonna go to the midline. You want this slapped back. Okay, so that's how you know to go to the midline instead of, you're always gonna pull the tape toward the center of her head. You know what I'm saying? So you pull up and you bring it around and squeeze it. Doesn't matter if this is uneven or whatever. And then, let me grab that last one. This probably is too short anyways. I'm just gonna cut that so it doesn't look totally uneven.
I taught you to wish not roll it down, roll over, give kisses.
Okay, same thing, just apply it to the post, gently wrap around. There you go. Yes. So again, you would do another one at the bottom. Now to do the bridge, you take a long piece of the cloth tape. This you definitely need 2 people for. The sticky part goes to the back, so you kind of look, put it in the middle, and then you take the tape, bring it around, stick it to each other, stick it to itself. Then what you want to do is kind of have the ears either parallel or slightly to the 11. Sorry, slightly to the 11 in one position. So right now they can be parallel, but as she gets more movement, you can put them to 11 in 1.
Okay.
Does that make sense? And that's it. So for now, I'm gonna just do this so that that is open.
But I will have her.
Doesn't matter if that flaps. Sash, no. And that's it. So here's some other pointers. She's gonna shake her head in the beginning and she's gonna try to scratch. That's normal. She'll do that probably all day. And the next time you do it. But if she's really scratching her head or crying or really digging, it's too tight and you have to take it off. Okay. I can guarantee you right now this is not too tight. So she's gotta get used to it. But if you do it and you find that she's really, you know, I've had people where they left them there and the dog's like rubbing their head raw and then the tip is they taped it too tight and the tip falls off.
Now when I take her